going to deal with pulp embryology and histology. Pulp embryology and histology will be dealt in detail in dental anatomy and dental histology also by Dr. Uday Bayo. But I want you to stress on certain things which may not be elaborated much in that particular session. So these are certain things you have to know with respect to your pulp. Number one, when do our teeth start forming? In fact, 5th week of gestation, human tooth starts forming. Your deciduous teeth starts forming during the 5th week of gestation. So you have to remember these timings. The mineralization of your deciduous teeth starts at 14th week of gestation, and the permanent tooth formation starts at 14th week of gestation. So the mineralization of your deciduous teeth, which is formed at 5th week of gestation, and the formation of permanent tooth, they both start at 14th week of gestation. Please don't forget this. This can come as an MCQ. So only the relevant ones in pulp embryology and histology I am going to cover today. And the dental pulp, what we see, is one of the most surprising organ in our body because of many reasons. Dental pulp is formed from the neural crest cells, the ectomesenchymal cells, okay, which forms the dental papilla. And it is the dental papilla that gives rise to dentine and pulp. So pulp and dentine, they both arise from one single organ during the embryological time, that is your dental papilla. And enamel is formed from the ectoderm, whereas dental pulp, periodontal ligament, and dentine, they form from the ectomesenchyme. Don't forget this. So during the formation of tooth, you have different stages, and these stages are the bud stage, the cap stage, the early bell stage, and the late bell stage. Okay, this particular formation will be elaborated more during your DADH classes and embryology classes. Don't worry about that. So when it comes to the pulp histology is always dynamic. The histology, the cells of the pulp changes with age as well as it responds to injury. So you might have learned in your BDS times that when there is an injury to the pulp, there is calcification, there is fibrosis, the pulp tissues change their cellularity, because the pulp is an organ like that with a lot of dynamics. It is generally a loose connected tissue what you have in the pulp, and along your dentine you have the odontoblasts which are lined like where they are very disciplined and lined in a particular pattern. And the fibers of the pulp, they are basically reticular, more of collagen, and they are argyrophilic. And the receptors inside the pulp, though a lot of questions in the exams have come from the nerves and the receptors of the pulp. So we have to deal that particular thing in detail. So the nerves in dental pulp, 90% are sensory. Only 10% are motor. So generally, where do you find the motor nerves? Usually in muscles, right? And do we have muscles inside the pulp? Yes, we do have. These muscles are nothing but the vasomotor. That is the capillaries, what you have inside the pulp. They need to do vasoconstriction and vasodilatation according to the level of inflammation or irritation what the pulp has. So for that, you have certain very little, 10% of the nerve fibers go as vasomotor inside the dental pulp. And there are two types of sensory fibers inside the dental pulp. These are the A fibers and the C fibers. Okay, the C fibers, they carry pain to the post-central gyrus of cerebral cortex. So remember these, the vasomotor fibers are efferent fibers from the sympathetic postganglionic fibers, and the sensory fibers, A fibers and the dorsal C fibers, they carry pain to the post-central gyrus of cerebral cortex. So these are certain terminologies which you have to remember when you go for your exams. And generally, proprioceptors are absent in the pulp. Proprioceptors are abundantly seen in the periodontal ligament, whereas it is absent in the dental pulp. Now, when it comes to A fibers, that is the most debated fibers in the dental pulp. You have two types of A fibers in the dental pulp. One is the A delta fibers, other one is the A beta fibers. A delta fibers, they account for almost 90% of the fibers. A beta fibers, they are just 10%. So if you ask which is the most abundant A fibers inside the pulp, it is nothing but A delta fibers. The feature of A delta fibers, A fibers, generally are very, very peculiar, because these fibers are highly myelinated, the A fibers. And because of their myelination, the A fibers, they can conduct the stimulus of your pulp in a very fast manner. So it's not a slow conduction. You might have experienced this in your day-to-day practice. Like when you take the aorta from the cradle, you might not have kept inside the patient's mouth. Before itself, the patient will complain of sensitivity. Doctor, it's already paining. Why? That is mainly because of the presence of these A delta fibers. These A delta fibers are highly sensitive. And these sensitive A delta fibers, they conduct that sensation very fast. So what happens is that the stimulus is being perceived by the brain without much delay. And there is no much of conduction loss also. So remember, the highest conduction velocity, remember this table, the highest conduction velocity is for the A beta fibers. Okay, after that comes the A delta fibers. Whereas you see the C fibers and all, the conduction velocity is very less. Why? Because they are not myelinated. So generally when your nerves are not myelinated and when they are of less diameter, you won't have much of a conduction velocity. So this is very important when you learn about the pulp embryology and histology. So when you compare the A delta fibers with the C fibers, A delta fibers are myelinated, C fibers are non-myelinated. A delta fibers are difficult to anesthetize. C fibers can be easily anesthetized. A delta fibers are concerned with the sharp pain what you feel inside the tooth. Whereas if your patient is telling dull pain, that is because of the C fibers. A delta fibers are thicker, C fibers are thinner. A delta have high speed of conduction, C fibers have low speed of conduction. So I'm sure that it's very clear to you. Now, when there is an inflammation inside the pulp, who mediates these inflammation? There are certain chemicals which mediate the inflammation inside the pulp. These are the histamine, bradykinin, serotonin, interleukins, and certain metabolites of arachidonic acid. And you have to remember two neuropeptides of the pulp, that is substance P and CGRP. CGRP is calcitonin gene related polypeptide. So this is something, whatever I discussed till now forms the basis of your pulp embryology and histology. Okay. Now let's come to some of the questions which have been asked from these basic topics. Number one is normal intrapulpal pressure. Because inside the pulp, there is a pressure, there is a blood pressure, because we know that pulp is a closed container. Just like your cerebrum, your brain, pulp is also enclosed in a heart tissue. It's a closed container. So inside this closed container, there is a specific intrapulpal pressure. And this intrapulpal pressure, you have to remember, it is 10 millimeters of mercury. So what you need in entrance preparation, you come across lot of values, lot of numbers. So what you need to do, you need to have small pocket diaries. Okay, I used to do that for my entrance. I used to buy the 5 rupee pocket diaries from this stationery shop, and each pocket diary I used to keep for one particular subject. And all the values what I learned from one subject, I used to write down in that pocket diary. And wherever I go during this year of entrance preparation, in my pocket, I'll be having these pocket diaries. So what I do is that when I travel in the bus or when I am sitting waiting for somebody, I take these pocket diaries and see these values. So these values, if you want to remember, you have to revise it again and again. So start buying the pocket diaries and start writing the values in the pocket diaries. And remember one thing, the only thing what you need to actually revise the day before the exam are these pocket diaries. Got it? Okay. So like I wrote my entrance exam in 2001. You are going to write the exams probably 20 years later, but still certain tips like this will not change. You might be having better digital mechanisms of doing this, but still I will share my small tips with you. Okay. Anyway, so the normal intrapulpal pressure is 10 millimeter of mercury. And what happens if the intrapulpal pressure increases? When do the intrapulpal pressure increase? Yes, when you have a pulpal inflammation, naturally intrapulpal pressure increases. A patient who is suffering with pulpitis coming to you, sitting in the dental chair, the moment you anesthetize and open the pulp chamber, you can see the sprout of blood coming out. Why does that thick, dark red colored inflamed pulp gives out blood like that, oozing out of your chamber? That is because of the increased intrapulpal pressure for an inflamed pulp. And if this intrapulpal pressure goes above 30 millimeters of mercury, then you have an irreversible pulpal damage. You cannot save the pulp using your vital pulp therapies. You might have to go for a pulpectomy. Now, what is the pulp capillary pressure? Because inside the pulp you have capillaries, and these capillaries, they have a pulp capillary pressure of approximately 14 centimeters of water. So you remember this is 10 millimeters of mercury, and your pulp capillary pressure is calculated as 14 centimeters of water. So the values also make sure that your standardization does not change. A patient with acute pulpitis, it is difficult to locate the pain. Why? Yes. Suppose if the patient is having a periodontal problem, many times you are able to locate that particular tooth. But when the patient is having an acute pulpitis, he comes to you like this and he is not able to locate which tooth it is coming from. And the answer is basically because we learned that pulp doesn't have proprioceptors. That is the reason why your patient is not able to tell you from which particular tooth he is having the pain. Short, sharp pain of tooth is transmitted to the brain by. The answer is A delta. Always when there is a short, sharp pain of the tooth, it is with the A delta. If your pain is dull, then it is going to be the C fibers. Dull pain is always pursued by the C fibers, whereas short, sharp pain is by the A delta. Pulpal inflammation is marked by, yes, the most important feature of pulpal inflammation is increased vascular permeability. Neuropeptide molecule that stimulates cell division in pulp fibroblast, that is what we saw, that is calcitonin gene related peptide. So now we got an idea what is a microsession is. The same thing which we followed in our free webinars also. So we will be discussing one particular topic and we will be discussing the